Hello, welcome back if you're a current subscriber. Welcome if you're new. So, I don't usually make videos about this topic. Obviously, you'll see by the title what this is about. But I did record a video and I felt like it was just filled with a lot of anger, and I didn't really want to come across in that way. So, I decided that I needed to change how I did my setup to hopefully give me more chill vibes. So that's the vibe that we're going for in this video, and share my journey with hyperparathyroidism and my diagnosis. So a little bit about me. I am 48. I'm a mom of seven. I am a nurse. I used to work with OB patients in the hospital, and about a year ago, I started working in the clinic, working with kids with complex medical needs, which I absolutely love. So I feel like God has put me where He wanted me to be in certain positions in my life, and I've been really blessed in my nursing career. I did a couple years during 2020 with school nursing, and that was great as well. But there's other things in my life. And so at that time, it just didn't work with my schedule and my kids. So I took a year off. And then when I went back to OB for a little bit and then decided to go with the clinic. The clinic has been great because with family, it just works a little bit better. So let's talk about my journey with hyperparathyroidism and what that actually is. So even now, sharing with my family and my friends, I've been getting a lot of the same questions. What is your parathyroid, and or is it your thyroid? Okay, so those are like the biggest things that people have come at me with, and I'm just kind of like, I forget. Yes, I'm in the medical field, so I understand. And then my husband gets it because he's gone to my appointments with me. So the thyroid is a butterfly gland that sits right here over, and it kind of like goes around your esophagus, windpipe, all that kind of stuff, right? So I'm going to insert photos for you just so you can kind of have that for reference. So it is, I'll insert that photo. And behind them are four parathyroid glands. So what those parathyroid glands do, again, all of those are endocrine, right? They're part of your endocrine system. So again, everybody knows what the thyroid is, but a lot of people don't know what the parathyroid glands are. So they sit behind the parathyroid. So their main thing is regulating calcium in your body. And from my understanding, now again, I'm a nurse, but I don't have a specialty in endocrinology. I'm learning all of this stuff in the last. My official diagnosis was in May, and so it is now the end of July. So in 2 months, I've learned a lot. Almost 3 months, I guess. I've learned a lot more than I thought I would need to know about the endocrine system. I was always like, I had gestational diabetes with my last three kids. So I was always so focused on being healthy to prevent type 2 diabetes. I wasn't thinking or worrying about when I was feeling this way that I would be thinking about my parathyroid glands. So those four little glands, primarily, it's usually one of the glands that starts to not behave and forms into an adenoma. Now, my understanding is parathyroid cancer is very rare, but I don't think they technically know until they go into the surgery and remove it. But maybe in some cases they do. I really just don't know because it is very rare. So at this point, we do know that it's one of my glands. Now, I do have one more scan next week, and I'll talk about that in my part 2 video. Right now, in this video, I'm going to talk about my diagnosis up to my, right before I met with my endocrinologist. So I have this lovely, if I can speak, I have this great Excel sheet that I put together for my doctors. So I just want to go over that because I want to come across is how I would speak to my patients, my family and friends, and educating them on this diagnosis because people don't understand what it is. Okay. I have been a little bit of background, which kind of, I think, is why things went really wrong. In 2015, my son was born with Down syndrome, which we knew, and he suffered, sadly, a traumatic brain injury or a HIE, which is a hypoxic ischemic encephalopathy, which is a brain injury at birth. We think his was sustained after birth. It can be during pregnancy, during labor, it can be after. We believe that his was sustained from some neglect. right after delivery. And I won't get into that because it'll make me cry and it'll just make me more upset about misdiagnoses and treatment. So my son, we were blessed with him, his birth in 2015. His name was Andrew. And he had a very tough little life on this earth, but he was such a blessing and a joy to us. And I had to be his advocate over and over and over again. And sadly, he passed away in June of 2016. So I was dealing with a lot, as you probably, I hope you don't know that experience or those feelings, but if you've lost a child, and I'm only going to speak on the loss of a child. I've lost a grandparent who was like my father, and that is, to me, it was very, very different, but it changed me. It broke me for quite a while. I wasn't the same person. I'm still not the same person I was in 2016. During my son's diagnosis, I was diagnosed with what they believed was an ulcer. I was treated with medication to help with the symptoms, which it did. But in 2016, after he passed away, I just wasn't feeling good. In the fall of 2016, I went into my doctor and just, I was feeling the weight of the world on me, right? I was struggling with my mental health. I was struggling with not feeling well from what we believed was this ulcer. So she did some labs. And she did check my metabolic profile, which is calcium, potassium, sodium. I don't remember what other ones in there because I don't want to I don't want to grab my Excel sheet because, like I said, it got me upset in the past and I don't want to do that. I just want to talk to you like I'm talking to my family. So my labs were abnormal as far as calcium. So it was elevated. I'm just going to tell you that. I don't need to give you specific numbers. Again, I just don't want to do that. I have them all. It's documented. But it was elevated more than normal, more than it should have ever been. So at that point in the fall of 2016 was the first time that my calcium was elevated. But because of my anxiety, my grief, and my loss, and my symptoms, they kept saying that it was anxiety, it was grief, it was my ulcer, which they technically didn't diagnose me with an ulcer even when they did further testing, but they just kept saying it was all my reflux, okay? So I just dealt with it, okay? So I went in several more times. One time was the ER because my reflux was so bad it felt like a heart attack, and it was just squeezing my chest so hard. So I went in, they did give me a GI cocktail, which is like this numbing. It's a medicine you drink and it does have numbing agents. If that helps with the symptoms as they're drawing cardiac labs, then that helps them rule out that it's cardiac related, right? So at that point, my calcium again was elevated. Now, I believe this was November of 2016. At that point, it was still elevated. So of course they recommended, because it wasn't my heart, they recommended I follow up with my healthcare provider, which I then did again. And then again, she drew labs. I think it was a couple weeks later, my calcium was still elevated. Now, she did write a note in there because I went and looked, and they all kept saying, well, it's slightly elevated, but everything else looks good. But in that time, in the end of 2016, they didn't do any further testing, okay? Long story, they continued to check labs, and with me coming in with more symptoms, extreme fatigue. One of the notes, it was charted that I was cleaning, and by the time I was done cleaning, let's say my house a little bit, I would fall asleep on the couch just as I sat down. There was extreme fatigue, pain, body aches. Like, I just didn't feel good. So again, they checked my levels. Again, my calcium was elevated. So now we're into January, I believe, of 2017. Now, if I have some of these dates wrong, again, I just don't want to pull up my spreadsheet. Let's just say 2017. Symptoms continued, symptoms persisted. So they ran more tests every time I was in, and then they did a connective tissue disorder panel. They checked Lyme's disease twice or three times in 2017. And in that time, I believe I can put the correct number that I was seen by a provider in 27. It was quite a few, like maybe 5 or 6 times I was seen by a provider. And some of those I think 2 times were in the ER from reflux symptoms. I really felt miserable, you guys. I felt so sick. And they kept saying, especially in 2017, late 2016, 2017, it's just loss, it's grief, go back to therapy. They tried putting me back on my antidepressant meds, which I refused because, oh my gosh, you guys, I felt like I was underwater swimming and I couldn't think. I couldn't do anything. I tried them for a couple months, and the doctors kept saying, well, keep trying them. And I'm like, no, I know my body. I know that this doesn't feel right. So I stopped taking them. I did try. I went back to therapy just to help with the loss, the grief, all of those kind of things. The other caveat in this is in 2015, 10 days after my son passed, or 10 days after my son was born, I suffered a delayed postpartum hemorrhage, which is very rare. Less than 1% is delayed 10 days, you guys. I almost died. I went to DIC, like it was bad. So I ended up with a hysterectomy because, like I said, I almost died. So that since 2015, like I suffered postpartum depression. At 6 months, I started feeling better. And then my son got sick. So like I have dealt with a lot of things since 2015, but I was feeling not as sick as I was by 2017. By 2017, the body aches, the bone pain, the GI symptoms, the anxiety. I had like these random palpitations, which then would cause me to have a panic attack because it would remind me of the day that I almost died. So all that PTSD would be triggered. Then I would go back to therapy and work on that. But if with hyperparathyroidism, you can have a gamut of symptoms, which I will share multiple times in this video of all people's different symptoms. You can have constipation, you can have GI symptoms. I was diagnosed with IBS, which is irritable bowel syndrome. That's a diagnosis they give you when they don't know what's wrong with you. You can have, again, the fatigue, brain fog, memory issues. Oh my gosh, there's so many that I've experienced. Like, it's so hard. Okay, so go into 2018. Symptoms continue. Yes, the brain fog that I had. So then I started deep diving into what we eat. So then my doctor said at one of my visits, again, I went in like maybe 6 times in 2018, a lot, okay? Every couple months I went in just not feeling good. I just didn't feel good. So 2018, I believe it was, I went gluten-free. I did a food diary and then went gluten-free because when I eliminated that, I felt less bone pain, which is true. I have felt less bone, muscle ache pain from that. I used to lay in bed before I went gluten-free, but I still have it, but it's not as bad. I used to lay in bed and my legs would hurt so bad. They just hurt so bad. And again, the bone, now that I know what my diagnosis is and why my calcium was high. So when your calcium is high, your bones, the calcium stays in your blood and your bones can't absorb the calcium. So that is why a lot of people complain about bone pain. So that is why my calcium's high, my bones are not able to pull anything from it, and that's where you get all this tremendous bone pain from. Now, you also have your body and your heart have calcium. You know, your body is very dependent on calcium. It can affect your heart, your kidneys, okay? So bones, kidneys, and heart are big things to worry about with hyperparathyroidism. And I think that's why I want to do this video. Like, if you have a high calcium, please do better than I tried to do, okay? Let my suffering for the last 9 hopefully help you, okay? So 2018, gluten-free. I lost weight. I got my breast reduction. I did, handled that surgery. I did all these things in 2017, 2018, 2019, 2020. I went on cruises. I went snorkeling. My anxiety was never like through the roof, except occasionally when I would have those heart palpitations. Like, I did all of these amazing things. I did them in honor of my son. I wanted to live my life. I went snorkeling from one end of a sunken ship to the other, and I didn't have fear after I got back in the boat, because only 10 of us went out of the group. I was kind of like, why didn't everybody go? Well, because people were afraid of sharks, right? And I was just like, not even thinking about that. Went parasailing, did all these amazing fun things. And so when they would say, well, it's just your anxiety, it's like, but I wasn't dealing with that. I went on cruise ships. I went on planes. I went to Disneyland multiple times. I went to California multiple times. I hate flying, but I did all these amazing things. So truly, anxiety really wasn't there, but every time I had symptoms, they seemed to blame it on my anxiety. Okay. So another thing. Gluten-free, I think, has been one thing that saved me that I didn't know that I think saved me, okay? And I'm not a doctor. I'm not an expert in endocrinology. So I'm just speaking from what I know and what I feel and what I experienced. So 2018, I went through that surgery. I did fine with it, obviously. Just sharing that was a major surgery in my life besides my postpartum hemorrhage. And I had several surgeries that day and eventually my C-section. Or not my C-section, my hysterectomy. I had emergency C-section with my last son, was another big surgery. But anyway, so I went through that 2018. 2017, my sister was diagnosed with terminal breast cancer, and thank the good Lord above, she's still here. So yes, I did have anxiety and stress in my life, but I didn't feel that my life was being driven by that. 2019, all this time, I want you to be clear. I had my calcium checked probably 4 to 5 times each year. Every single time it was elevated. Every single time. And yet they checked me for everything else. They checked my thyroid multiple times in the last 9 years. It's never my thyroid because your parathyroids are not your thyroid glands. Okay, can I just say that? Okay, I'm going to get a little feisty maybe, okay? So 2019, same issues, okay? The bone pain got better when I went gluten-free, and I also don't eat as much sugar in my diet since then. In that time, I also started spinning in late 2019 and to 2020. And I always felt, even spinning, I haven't spun in the last 6 months because I've really not been feeling great as far as my bone pain and exhaustion and fatigue. So really, and then before I went gluten-free, the brain fog, 100%, I felt it. I felt it a lot. But everybody, when I went gluten-free, the doctors just said, oh, well, you must be gluten intolerant, right? Okay, so that's what I went with. So the brain fog, again, I do think my symptoms and God above has helped me for 9 years, because you can have, again, kidney issues, fractures, and heart issues. Those are very much, you would think, now I'm not an expert, but 9 years dealing with this, I am so thankful that God and my son were watching over me, because I do feel like it could be worse than it is right now. And I'll give you a few examples of that. But so from 2020, we all know what happened in the world. So then I just stayed away from doctors until 2023. I did. I was doing okay mentally with my therapy. I was spinning. I was eating good. So I felt better. Did I still struggle with those random palpitations? Yes. Did I still struggle with my body feeling like I aged overnight? But I mean, it wasn't overnight, it was 9 years, but I feel older than I am. But let me just say this. I'm not a victim. I am not a pity person. I get up every day and my body hurts. I don't care. I thought, well, maybe it's just getting older, but I don't think it is. I'm so looking forward to after, because I want to know how I feel. And I'm doing this video so I want to encourage you, if you've gone through this or you're just on the start of your journey, I want to do these videos. So I want to share my diagnosis, my journey with endocrinology, and then post-surgical, because I want to be a light, hopefully. So like I said, that hopefully this doesn't occur to you or someone you know. So again, every single time, so from 2020 to 2023, I pretty much stayed away from doctors. I did my yearly physicals because we get a break from our healthcare insurance if we go get our cholesterol checked, and we do our little physical, but I never brought up anything because it didn't matter. It didn't matter. And then in that time, I don't believe that I had any lab draws as far as related to that. Only my husband's work checked my blood sugar and then my your cholesterol levels. And then in 2023, I went back because I was having some pain in this side, and I didn't know why. So when I went in, again, I went to a different provider, a male, and he checked my labs because I have a family heart history. 2 of my uncles have died in their mid-50s, and I'm 48, so this was 2 years ago, so I was just like, I want to make sure that my labs are okay, my cholesterol was okay at my last visit, my weight was okay. Like, I'm not a skinny person, but I feel like I'm average. So I was doing, I try to do right by my body. I spin because I have a family heart history and it terrifies me, and because spinning makes me feel good. It helps decrease stress and anxiety. So the doctor at the time in 2023, I believe it was in fall, he checked my labs and my calcium again was elevated. He didn't say anything, he didn't do anything. So I thought, whatever, freaking forget it. So then, because my sister's diagnosis, I always get my mammograms. That's pretty much it because I don't, because my sister has breast cancer. So I do that as well every year since I turned 40. So besides that, I really hadn't gone in. I just tried to stay away because nobody was listening and I didn't really feel like it was necessary. And as a nurse, I just was tired of it, right? So 2023, I went in and I saw a male provider and kind of went over my symptoms I was having. And he did do labs and the calcium was elevated. But again, no follow-up was done. Nothing further was said. He just said, well, it's a little elevated, blah, blah. That was basically it. Every time it was just a little elevated. Between 2023 and late 2024, I went in because I was having some pain in my neck here and here. I was just really feeling frustrated. But in 2025, I was having more skin issues. And again, that itchy armpit that I was having, I couldn't explain, changed my deodorant, changed my detergent. Nothing was getting better. So I had seen a dermatologist. She really couldn't explain it. So then I met this doctor. And so she drew my labs for perimenopausal. She drew labs, like a bunch of labs. Okay. And we just kind of talked through things. Well, then when she got my labs back, she saw my calcium was elevated. And I just said to her, I don't care. I said, it's been elevated for, I don't know how many years. Like, I knew that it was a long time. I just didn't know until I started digging how long it was. So I just said, who cares? It's been elevated for a long time. Nobody's cared. Well, she didn't like that answer. She just was so thorough. She's just so good. She's just very on top of things. She's gone through some things in her life. So she just is on top of things. So she's like, this is what we're going to do. At this time, I was having some, besides the pain in my neck, I was having some fullness in my right breast. And because of my sister's breast cancer diagnosis, and it had been 6 months since my scheduled yearly mammogram, she wanted me to make sure that my mammogram and ultrasound, so I had to go do all that. So that was February. So then in March, she hassles me that we need to redraw my calcium because, it was high. And I'm like, whatever, I don't care. So again, she hassles me in April of this year, okay? I said, fine, whatever, because we had to go over the mammogram and all that kind of stuff. So I was like, fine, I'll just schedule the lab. I'll come in and do them quick. So she does them right before we're going to go to Florida. And she's like, it's elevated. I need you to come in for a parathyroid. And I'm like, okay, whatever. So we're going to leave. So she's like, so I drove in the morning because we were leaving at noon. So I drove in the morning to go get my labs drawn and then came back home. So the parathyroid one has to be refrigerated or something. It's time sensitive and it's temperature sensitive. So Monday they call us and I'm in Florida and the tech is, whoever it called me is like, hey, your parathyroid level we had issues with it, so we need to redraw it. And I'm like, whatever. So I wasn't even going to do it because I'm like, now I'm frustrated, right? But they're like, well, you already paid for it. We really need to redraw it because we don't want someone to get in trouble. So the doctor is really adamant that you have it drawn. And I'm like, fine. So we came back Sunday. We drove straight through from Florida with our, 4 of our kids went. And so we drove straight through and I was tired, but I got up Monday morning so I could do this lab for them. So I get a call on Wednesday. Then it's May, beginning of May. And I don't remember exactly, but it was May at this point, beginning of May. And she says, your parathyroid level is high. And it was like in the 70s. I think it's 60 or 50s is normal. But it was 78, I think. She's like, okay, I have a few more labs I want you to do. And I'm going to send a referral for endocrinology. And I'm just like, what? So I had to start digging on what is hyperparathyroidism. Now I have primary hyperparathyroidism, which is, I guess secondary is because you've had like kidney issues or broken bones, which I haven't done. So that is this part of this video. That is how the heck did I get here? If you have any questions, you can leave them in the comments. Let me know if I can help you. I'm not a doctor. I'm a nurse. Again, I don't give advice. I don't assess things. That's not my job. This video is just to help you if you're on the journey of being diagnosed with hyperparathyroidism. Primary is I don't have the symptoms per se. I've not broken a bone. I don't have kidney issues. Again, you can have heart issues as well. Usually those are pretty late. But again, I've been dealing with this for 9 years. I do believe that God had his hand in this and keeping me safe. So I don't care if you believe that or not, but that's what I believe. And that's why I think my symptoms, I've just dealt with them and maybe why they're not as terrible. So thanks for watching, commenting. Please subscribe. But so you get notified of the other ones. I will do a playlist once I post the other ones. Again, this is not normally what my channel is about, but I just want to share this. So in case you're out in the big world like I was and start searching hyperparathyroidism, you can find somebody, and hopefully this will help you be an advocate. Do not accept a high lab. If you don't like it, go get a second and third opinion. Fight. Ask questions. Don't just accept from a doctor that it's just slightly elevated. Your calcium, let me say this is going to come in part 2. Your calcium is so fine-tuned by your body, it should not be elevated and it should not be low. And if it is, there's a reason and you should find out why. All right, thanks for watching. See you in part 2.